A hernia is a defect in your abdominal wall, whether it's something that you developed over time or something that you may have been born with and just had gotten larger. It's basically a hole in your abdominal wall that tissue is coming through. The most common places that a hernia occur are down in the groin, something called an inguinal hernia, or usually at the belly button, something called an umbilical hernia. A lot of people may think that they have an outie belly button. If you do, that's most likely a hernia. Usually the symptoms of a hernia are a bulge that's coming through either in your belly button or down in your groin. A lot of times it can be painful when you cough, sneeze, or go to lift something. And when you lay down at night, a lot of times it goes away because you take the pressure off and so it kind of goes back in, but that's not always the case. If you do have a bulge and you have pain in your groin or your belly button, those can sometimes be indicative of a hernia. The role of the general surgeon is to fix that hole and make sure that tissue is no longer going through that. Even if those hernias aren't causing you any problems, or your doctor may have said, oh, until it starts causing you pain, you don't need to have surgery on it, it's a good idea to go see a general surgeon and let us kind of discuss the options with you, because sometimes taking care of those hernias when they're smaller before they become painful can have a better outcome and sometimes be done with smaller incisions.